Welcome to the Unfettered Wealth Podcast with Eric Tashlein from Connecticut Capital. In this podcast, we help business owners and successful professionals plan for better wealth outcomes. Join us for this journey where we explore ways to help you identify better wealth decisions to help you achieve an unfettered life. It's time to ask yourself, what do you want more of?
Hello and welcome to Unfettered Wealth with Eric Tashlein. Eric, what's going on?
Hey, good morning. I have my good buddy, Dr. Keith Steigbigel, on this morning.
Yes, you do. And we were talking just before the podcast started, and I can't repeat anything you guys said. So let's just dive into the podcast. So why did you bring the doctor on the show today?
That's normal.
Yeah.
All of our clients, generally 40s to 70s, and, they're all trying to live great lives. And, along the way, people have health issues, and oftentimes it's back related or joint related. And so Keith is known for that, working in that area. I wanted to bring Dr. Keith in just to kind of go over some techniques and thoughts in terms of improving your overall health.
I think you brought him in because you and I have been talking a lot, and I complain a lot about my arthritis and my back and my knees and everything. So I appreciate you bringing him on. I'm looking forward to hearing what you guys have to talk about today.
Absolutely. It's funny. I heard on a podcast the other day, this gentleman said, he goes, as you age, he goes, the hard things get softer and the soft things get harder. And I'm not sure if I want to experience either of those, but it's part of aging.
I'm not sure
but
I
anyway,
can touch upon that today either.
Yeah. No touching policy on this podcast, just to let you know.
Exactly. So good morning, Keith. How you doing?
Good morning, Eric. I'm doing great, and thank you guys for having me on. I'm excited to chat, and I appreciate the opportunity to talk.
No, absolutely. So for those of you that are listening that may not know Dr. Keith, so it's Dr. Keith Steigbigel has an office called Prolete. It's on the green here in Milford. I'll just give you a quick bio on him because it does look like your mom or dad wrote this about you, Keith. Keith is a highly respected physical therapist. He specializes in sports medicine and orthopedic manual medicine. He's board certified as an orthopedic specialist. And he's really known, and I know this to be a fact, as the doctor's doctor specializing in difficult and unresolved cases.
I appreciate that generous invite to the talk today. And most of that is true, I hope. I am a physical therapist, and that's what I do.
I know you are from a long line of doctors, and I know your dad's a leading infectious disease doc. Why did you end up choosing physical therapy?
When I went to school in Ohio, I was recruited as a swimmer out in Ohio. So I was an athlete growing up all through high school and whatnot, and obviously into college. I had no clue, like most kids going to school, what they wanted to do. I actually thought I was going to be a marine biologist because I liked the water and floating around and surfing and whatnot. So, why not be a marine biologist? Because that sounded pretty cool. And I got out to Ohio, and they said, sure, you could do that, and you have to take all this chemistry. And I'm like, that doesn't really sound as much fun as I thought it'd be. I sort of switched into the athletic training, exercise physiology world, and then later found out I'd take all that chemistry plus more, but that's okay. As my education within the exercise physiology world progressed, and that's a whole other longer podcast, but farther along into the end of my education in my undergrad, we had to do a rotation somewhere within the related field. So here I am in small town Ohio. I found this guy who had a small PT practice. I really actually knew very little about physical therapy. I asked if I could come in and hang out with them, and I had to do a semester's worth of observation. Mm-hmm. And it was, in a sense, life-changing. I'll remember this man forever. In a sense, he really opened my eyes to what my career is. And I think, lucked out to choose an individual that, ran an office and ran his philosophy, rather, was something that I still look up to. He had the opportunity to work with patients in the community. What I liked the most was the amount of time he got to spend with his patients, the relationship you could develop with a patient over time, because it's not like other aspects of medicine where you get 10 minutes every 3 months. Mm-hmm. This is, an hour or sometimes 2 to 3 times a week for 4 to 6 weeks or longer, based on their predicament. And to see their progression and to see their lives change and the results you get and the smiles you get back was, to me, a very rewarding thing to be a part of. As I finished up my education there, I came to Connecticut to follow my now lovely wife. Mm-hmm. I worked in a practice here as an exercise physiologist and in physical therapy, and decided to take the next step, and then did my post-grad here in Connecticut. And then it's just a long line of education and things after that that got me to where I am today. But that was sort of the base of how I got to here. So yes, that was Mr. Taylor. I will never forget him. So yes, that was my beginnings in the field.
No, it's just awesome to have mentors. And I know I can attest to, I've worked out with you for many, many years at a gym locally here. I've seen your work, really change that individual situation. I've seen some people leave the gym hobbled because they were trying to lift too much. And then a week later, like, thank God I saw Dr. Keith and he put me back together. So I know what you do works, and I've experienced it myself as well.
Well, I appreciate that. I mean, physical therapy is a unique field where it's another set of tools within your tool belt that you don't necessarily get in other aspects of medicine. And it comes down to it. To me, it's a little bit more of a bridge or a marriage between art and science, where the art form is with your hands, and over time you learn to use your tools, in this case the hands, in manual ways that will develop and become skilled the more you use them. It's like anything else you do in life. The more you put time into something, the more it becomes skilled in your abilities of what you're doing with that. But the art form of what you do manually is that neat mix you get to then bridge with science of how you're doing it, why you're doing it, and the prescription of exercise and the other aspects that go into it. So it's a growing field. It's been a fun field to be a part of. It's been a fun field to watch develop over the last 10, 15, 20 years. I've been doing it for 20 plus years now. And even within those last 20 years, I've seen a huge expansion within the science of what we do. And If I look back in 40 years of where it came from, it's been pretty interesting to see it develop.
Yeah, no, we spoke about it yesterday. Like, I played Division III lacrosse. It was like a good high school team. But when you were hurt and you rolled an ankle, back then it was just throw it in ice, isolate it with tape for a week, and you guys have a whole basically bag of tricks now in terms of treating something like a bad ankle.
Yeah, we talked about this a little bit yesterday. Like that's a little segue from the ice baths and whatnot. I know we've talked about this before. I'm actually lucky enough to also teach at Quinnipiac, and I instruct their medical students. And I had a lecture the other day where I was talking to them because my goals at this stage of my life is to pass on as many pearls as I can to whatever students of health, whether it's physical therapy or medical students that I can work with. And one of the things we were talking about is the technique of ice and rice. The old rice theory of acute ankle sprain. We immediately add the rest and the ice and compression elevation, the acronym for rice, which was developed years ago by this one guy, and was sort of put out there, and everybody sort of grabbed onto it. And he later, years later, sort of detracted from that, saying, I may have been not correct in the science behind this, and which is great, because that's part of what we have to do is recognize when maybe things are not what we originally thought they were. But the original thought is ice it down, get that swelling down. But now that we know a little bit more about science and medicine, that first 10 to 12 days are so important to allow some fluid to get into that tissue, to allow within the swelling, which is actually the blood, some of the important aspects of healing, which creates the scar tissue. These collagen fibers form within those first 10 to 12 days, and that makes a strong ligament or tendon that you tore. And so knowing that now, here we are 10, 20 years later, we're pushing away from the ice originally or immediately after the acute ankle sprain and joint injuries. And thanks to some research done and within the military model, there's been a lot of good research that comes out of there, where they've looked at military personnel that been out in a rucksack run, and they roll the ankle, and they come in and they see the physical therapist, which in the military model is the primary care provider for all musculoskeletal injuries. They do all the initial evaluations and treatments and order whatever imaging and medication need to be done. And with some research, they found that those that receive some light loading and movement patterns early on versus giving them an NSAID like an Advil, Motrin, ibuprofen, which also will decrease inflammation along with ice, those that did the other of movement did well later in terms of less re-injury, more of a stronger healing tissue. Again, taking that knowledge forward is allowing us to do better things. So That was
That's
a very
awesome.
long segue from a very short little story you had about your lacrosse days.
No, but it all makes sense. One of the mysteries for me is I'm always like, some people are like, "Hey, you got to go see my chiropractor," and then others like, "You have to go see my PT." For me, the line is blurred, and I'd just be curious. I think listeners also be curious. Like, so, what's the main difference? I know you guys kind of work together in a sense.
Yeah, no, I hear that all the time. I get patients ask me that probably weekly. What's the difference between you guys and a chiropractor? And, for some people, the chiropractic philosophy works for them, and great. If they find relief from that, then all of a sudden, then that gets them back to where they want to be. The philosophy of what we do, typically the difference is, and again, as people develop within their fields, they sort of pick their path. But if you go back and look at the schooling, the philosophy is the biggest difference. The chiropractic philosophy looks at the spine as the source of all issues and evil, and they use what's called a subluxation model, where they believe joints within the spine can sublux and need to be relocated or repositioned, some of the terminology they might use, to get somebody back to movement patterns. And that's the sort of the primary source of what they will do for their treatment. Mm-hmm. The physical therapy model is different, where we don't believe there's drastic subluxations or real movements within the spine. And one of my side jobs, as I was telling you, is I teach at Quinnipiac, and one of the things I teach is the cadaver dissections. It's called gross anatomies, where we dissect the human cadavers for learning purposes. And we dissect all the way down to the spine. I can tell you that thing is pretty solid. We're not moving those joints around, with much ease. So stepping off a curb really is very difficult to sublux anything. The philosophy of physical therapy is movement. And sometimes we will do some mobilizations. We will occasionally even do some manipulation, but it's for a short, open the window, get something moving better with some blood flow and some increased laxity within that joint to allow it to move better, so the muscles that surround it are no longer in a guarded state. Muscles have two jobs. They either move you or they protect you. And when you feel, or when the joint sends a signal of pain out to the surrounding tissues, it goes into a spasm of muscle, or the muscles lock down to say, okay, I got to protect this. If the patient doesn't get those muscles moving better or get to a point where they can relax, and the joint will never fully start to move again. So our purpose is to get those tissues moving better so that we can get the muscles to get back to their normalcy. And then we prescribe a lot more exercise. We are more trained in the world of exercise prescription and giving the patient a little bit more independent tools and treating themselves. The chiropractic model, typically it's more of a model of, I will continue to take care of you on a regular basis to keep your spine healthy and mobile, but there's usually a little bit less of a exercise prescription plan going home with the patient. Not to say that some chiropractors don't go that other road, and not to say some physical therapists don't do the other road, but that's the general difference between the two.
No, and I appreciate that, having worked with you. When I go home and I'm doing those exercises, for the first time, I've actually listened to your advice, right? And, continue each morning. I wake up, I stretch, and, do the various exercises. And I've not had any major back issues for a good while. So it pays to listen to your doctor.
Yeah, well, it's funny because it's hard to sometimes get people to buy in. Exercises sometimes are not the most exciting thing to do in the world. They're not the sexiest activity to do in your workouts, especially the ones that are small movement patterns, just create stability. In a sense, I try to talk to the patient. This is no different than if your physician gave you medicine for your diabetes. If you stop taking that medicine, yes, your diabetes will get worse. If you continue to take the medicine, then hopefully we'll be able to control that with other aspects of better living. The exercises are a prescription for health. If you continue to do the prescription I provide you, you should continue to improve. When you feel better, if you stop doing them, there's a good chance you may go back to square one. Just because you feel better taking your medicine for diabetes doesn't mean you stop taking it. You're feeling better because you're taking it. So It's you have to sometimes put it in that mindset of why we're doing this. Yes, as we improve upon things, you can maybe titrate down and add other things, and that's the hope, is to add other activities that you also find fun to do. But there's a certain level of some of that stuff that just needs to be done on a regular basis to maintain the health of what we're working on.
Yeah, Roger that. I totally agree, because No offense, I didn't listen to you in the beginning, and I kept getting hurt.
No, trust me, I get that, and I call that job security. A good portion of my patients do the same thing, so God bless them. So that's why we're busy.
In terms of the clients we work with, generally they're in their 40s and through 70s, as I said earlier, and they're trying to maintain optimal health as best they can. I think everybody feels mentally young even when they're 80, but their bodies don't agree. For everybody listening, what are some things that you've found along the way that really work and can help improve their lives?
Movement is medicine. It's a tagline that we use in physical therapy a lot, and it's true. And I think it really comes down to each person. You can't group everybody into the same circle and say everybody must do this particular thing. Everyone must go do CrossFit. Everybody must go do Pilates. Everybody must go do yoga. It has to be something that you will find interesting to yourself, that you'll look forward to getting up and doing on a daily basis. It might be going for a walk with the dog twice a day. It might be doing high-level activity HIIT class. It might be doing the pickleball game with your friends 3 times a week. Movement in itself is just an important aspect of what keeps us moving. I've used this analogy before with other people. I think you and I have discussed this. I have this fun little 1976 911 air-cooled Porsche. It's a fun car, cool. and my mechanic will tell me every time I bring it in, it's like, how much are you driving this? I'm like, he's like, I've told you this before. These cars have to be driven. They got to move. Those engines, if they sit, the gaskets and the seals dry up, and the oil, you get your oil leaks and the other issues. And at the end of the day, we're not that much different. If we sit and we don't do our movement patterns, the synovial fluid within our joint tissues don't move around as much, and you don't start pumping in and out some of the healthy fluids that go in and out of our joint tissues that our body reabsorb and push back and forth, and our muscle tissues are constantly sort of needing some of that stress to create health. Our bones actually grow based on stress. The cells, what are called osteoclast and osteoblast, are the 2 components that make a bone matrix break down and rebuild on a daily basis. And part of what that is gravity. That's why when the astronauts go up into space, they come back down, their bone density has been reduced because they lost that level of stress to the bone, the gravity. But to make it more or improve, we have to then stress the stress. So that's resistance exercise. It could be walking in the deep end in the shallow end of the pool. It could be swimming. It could be biking. It could be running. It could be using elastic bands. It could be going to CrossFit and lifting crazy weights. It doesn't matter as long as it comes down to something you will do on a regular basis. If you are making yourself do something you don't enjoy, it will stop. It just is what it is. Yeah. It's like doing a diet you hate. I'm like, I got to do this diet because I got to lose some weight. I can't stand it. Well, then it's not going to last. And so we have to just find some activity level that we enjoy. And sometimes it's just setting a clock on your desk that goes off every 30 minutes and makes you walk over to the water cooler, get some water, move around, do a couple of stretches. There's lots of things out there on simple desk movement patterns you could do, standing up, bending backwards, do a couple squats back and forth in your chair. But if you do that on a regular basis, within a few weeks, all of a sudden you start feeling better in general. And we know that by science, but you'll know that by just clarity of the brain, the endorphin release, the feeling better about your environment, less groggy, your joints feel a little bit better, as we were speaking before when Eric introduced us about his aches and pains. That's a pretty common thought of, oh boy, here comes the morning. Let's see if we can move. So, I wish I had one recipe for everybody. If you do this, you'll live forever. But I think that recipe really is just find some movement that makes you feel good and that you can do on a regular basis.
Yeah, definitely. There was a scientist who, was an athlete as well. He's in his 50s, and I was listening to his philosophy, and we spoke about this yesterday. I think it makes sense. He's like, hey, listen, he was 50. He's like, I will probably be a grandparent when I'm 70. And so he kind of recognized, he's like, every year I'm going to lose a little bit of strength potentially from muscle. I want to be able to pick up my grandchildren off the floor. And if the kid's, 25, 30 pounds, I know I need to be lifting 2 or 3 times that at this age, right? And be preparing myself, getting my balance ready. Because, we always judge. I judge grandparents by, are they sitting on the floor with a kid, or are they sitting there with their feet up watching TV while the kid's in the room? And
It's funny you say that, even the balance part. I was talking to one of our mutual friends this morning at the gym, and I was doing an activity that included a little balance work, and he walked over and he's like, what are you doing, blah, blah, blah. And I'm like, well, this is, I'm doing this thing that not only is it going to help strengthen my back, but it's actually helping my balance. So he jumped in and he's like, well, I'm all over the place. I'm like, well, looks like you need to do this. He's like, yeah, I've noticed as I've gotten older, my balance has gotten worse. He said, well, that's a normal part of of aging, of having birthdays, the birthdayitis. It doesn't necessarily mean you have to embrace that, and it just means we have to sort of challenge that. And sometimes the simplest thing I'll have patients do is say, okay, what do we do on a regular basis twice a day? We brush our teeth, at least hopefully. So in the morning, you balance on just your right foot as you brush your teeth, and in the evening, you balance on just your left foot as you brush your teeth. So you're applying an activity to something you're already doing. You're not trying to create another task for yourself. But by trying to do that and do it with a little bit of focus, meaning taking your big toe and sort of grip it into the ground like you're making a claw with your foot, you're encouraging these small little intrinsic muscles around the foot, the ankle, which then goes up the chain into the knee and the hip. And if you do that on a regular basis, you'll notice it gets a little bit easier and a little bit easier as the weeks go on, which then you'll notice as you step off a curb, as you go up a stair, as we make movement patterns where there's a single leg stance, which we do every time we walk, or getting up and moving quickly to grab something, or you're playing with your grandchild, you'll start to feel that benefit go forward, even if it's maybe pickleball or whatever the case may be with lateral movements. But finding a way to sort of challenge your balance can make a big difference.
That's an awesome tip. Thank you for that. I'm sitting here on one leg while we were speaking. I'm like, I got to work on that.
No worries. That's a freebie for you, Eric.
So, some of the folks that listen are running businesses, and I'm always impressed. I'll come into your office, and it's a well-run machine. How do you do that? So you're managing dozens of patients during the day, and so I guess I wanted to ask you, like, what from a delegation standpoint or management standpoint, how do you manage all of those cases?
Yep, that's a great question. We've built a practice so that when we are with our patients, we're with them individually for that time period, which gives them a sense of like, I'm here for you and I'm here just for you right now. Mm-hmm. It is a business, so we have to keep the doors moving and the people. There's a lot of people that want to see us, which is a good thing to have. And I have multiple practitioners in the practice, which is also great. So it can create a fun, busy atmosphere. And we've talked about this before. It's sometimes like being a chef in a busy kitchen. You just have to know which pot is where and what needs to be checked on and what might be boil over soon. And it's just know your surroundings, being aware. But it also comes into play of being present. And when you're present with your patients, it allows you to have that connection and remember who they are and what their needs are. So when they're coming in, it's not a blank face to you. It's like, you could pick up where we left off. Say, hey, last time we chatted, I gave you some homework. We did this and that, or I did this technique and I worked on that, or I threw some dry needles in you. How we feeling? You said you were going to actually go on this trip, and how to go with that 6-hour car drive. I knew that was really concerning for you, and having that connection for them, like, he remembered that stuff. I'm like, he's got all these patients, he remembers it. Well, yeah, because that to me is an important aspect to make them know that they're an important person, and it's not just a number to me. It's not just another person that comes in my door. It's like that's their individual time, and I'm here for them individually for that time. And having that connection will give them a level of confidence. And if you don't have confidence with your provider, your ability or your want to follow through on their instructions is drastically reduced. If you don't have confidence in what they're telling you to do, then typically you typically won't follow through as well, and you won't take their advice on why you're supposed to do this. And that's why education is a big part of it. And we constantly are educating the patient, like not only why are you doing this, but what is the pathology behind it? And that gives them that level of education. But so again, back to your question, is just creating that relationship with the patient, which is no different than any other avenue of business, so that they feel that your time is their time when they're there, and that they're being listened to, so that when they come back, they know they're just not another number. They're a person that makes a difference.
Yeah, no, and I see that there. It's like almost like a family atmosphere within the office and with your patients. So that's awesome. these days with healthcare, I know it's busy, right? There's forms, there's responsibilities. When you do have downtime, tell us a little bit, Keith, about your family, any hobbies that you have outside of work.
Downtime is precious rather. So when you get it, you want to use it to its fullest. I'm blessed that I have a family that we all enjoy doing very similar things. We're an athletic family, which is important to us. My wife and I both work out at the CrossFit Milford here 6 days a week. It's what makes us go. It makes us get up in the morning. It keeps us feeling good. My kids are all athletic. They all come from athletic backgrounds with sports in high school and college and whatnot. We usually try to do some activities that involve that, but we're also big travelers. We love traveling. Been blessed to be able to travel all over the world. And the fun part is every 2 years we try to pick some sort of big fun trip that where we can go to next. Our last excursion was Fiji, which was amazing.
That's awesome.
Yeah, my kids, I'm a big scuba diver, or at least I used to be before the kids came along. And then now that they're at an age where they can enjoy me, I've gotten back into it, which I love. And I've gotten them certified. And so they did their certification here, and then they did their open water diving in, actually it was in Thailand, and then Fiji. And I told them that this is not normal scuba diving, so don't get used to this. But to us, it was really fun to be able to have that time together and experience that with them.
They are so spoiled. I'm going to bring them out into Long Island Sound and see how they do there.
Exactly. You want to see scuba diving? There you go, guys. See if you can see your hand.
That's fantastic. I also saw the other day, I was very impressed. I saw that you had been boxing against a much younger opponent. So you have to talk. How'd you do?
Did wonderful, thank you. So yeah, you got to find things that you like to do. In my younger days, I did some boxing for a couple of years when I was going through PT school. It was my way to. I thought it was like, I'm just going to go do this to stay in shape, and because I was, didn't want to get back in the pool after swimming competitively for 16 years. So I walked into a boxing gym one day, and I had a little bit of skills under my belt, just enough to be able to, pretend I knew what I was doing. And the coach said, "All right," and started working with me. Before I knew it, he threw me in the ring, and I started boxing for 2 years, amateur, and it was a really, to me, it was an awesome experience because it gave me an appreciation for what boxing is. It's an art form, and it's a chess game. It's not just hitting somebody. It's actually understanding. It's planning. It's not your first punch. It's your third, fourth, and fifth punch that actually makes the difference. It's watching the person move in front of you and trying to figure out how you can counter that. And if I do this, they're going to do that, which then allows me to do this. So it's a thinking game, but allows you to focus your attention to just that, and the rest of the world disappears for a period of time. So I have my friend who invited me to get into the gym with him, and he's been working with another local guy who's an MMA professional fighter who's an awesome guy, Eddie George, and he said, "Hey guys, my buddy Jay was working with them, and he's invited me over to jump in the ring." So yeah, we went a bunch of rounds and hit some pads and hit the bag, and it was good time. It felt like the little neurons started firing again.
That's awesome. I mean, I love any hobby where you forget, everything else falls by the wayside. In boxing, obviously, you have to focus or you're going to get hit hard. But whether it's boxing or skiing or any of those activities or scuba diving, that's great. I appreciate all of that. In terms of improving people's lives, are there any books that you've given away or any suggestions that you make to friends to improve their lives?
So one of the books that I've come along the way in my profession, and it still holds up. It's been out for a long time, but it's an easy book to read in terms of, it's more of a pamphlet really. Because at the end of the day, we see every injury. We see necks, backs, shoulders, pinkies, wrists, elbows, whatever you can think of orthopedically. But the spine is, it's a consistent issue for a lot of people. And this guy, Robin McKenzie, he was a great practitioner. I think Robin was pretty sure he was a Kiwi. He was a New Zealander. He created a book called Treat Your Own Back and Treat Your Own Neck. And it's a pamphlet type of book. It's thin, but it's simple. Quite honestly, there's a lot of exercises that I prescribe in there on a regular basis for just teaching somebody to move to stretch and mobilize themselves on a regular basis. And if you follow a lot of his simple guidelines in there, it's a simple way to stay away from me and a simple way to, after seeing me, continue to be healthy. to me, that's like a simple, easy
That's awesome.
go-to for those that have a lot of low back and neck issues.
No, that's great. That's awesome, Keith. So for anybody listening, if they have some aches and pains, they want to reach out to you, what's the best way to find you?
Yeah, as you said, I'm at the end of the Milford Green here. Our practice is Prolete Physical Therapy and Sports Medicine. You can find us on the web, Prolete Physical Therapy and Sports Medicine.com. You can come visit us down at the end of the green and pop in and say hi. And we love to chat and take a look.
That's great, Keith. Hey, thank you so much for joining us this morning.
Thank you, Eric. It's always a pleasure chatting.
Guys, this was a fantastic podcast. Just really enjoyable. It's so funny, Dr. Keith. I got my scuba diving license in the Puget Sound in Washington State, which, wow, that's cold.
There
it's
you
just
go. Yeah,
ridiculous.
It's cold.
I love the water, so it didn't turn me off from scuba diving. But I was thinking, man, it would be really nice to see a fish that had some color. All these brown fish and gray fish. Anyway, but no, that's a great activity. Love the endorsing over and over again of just get moving, find something. Do something to improve what you do. So thank you so much for being on the show. And of course, Eric, thank you so much for bringing him on the show. And of course, our last thank you goes to you, the listening audience. Thank you for tuning in and listening to the Unfettered Wealth Podcast with Eric Tashlein. If you have not subscribed to the podcast yet, please click the subscribe now button below. This way, when Eric comes out with a new podcast, it'll show up directly on your listening device. This makes it much easier to share these podcasts with your friends and family. Again, thanks for listening today. For everyone at Connecticut Capital Management Group, this is Eric Johnson reminding you to live your best day every day. And we'll see you next time.
Thank you for listening to the Unfettered Wealth Podcast. Click the subscribe button below to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guest and does not necessarily represent the views or opinions of Connecticut Capital. The content has been made available for informational and educational purposes only. Content should not be construed as personalized investment, legal, or tax advice. Please consult your advisor, attorney, or tax advisor in regards to your individual situation. Eric Tashlein is an investment advisory representative of Connecticut Capital Management Group, LLC, a registered investment advisor. Connecticut Capital Management Group, LLC, and Connecticut Benefits Group, LLC are not affiliated.